What's up guys, welcome to another week's episode of GetPsyched, where we look at all things mental health and psychology. Now often, and over the past couple of weeks, we've been taking a look at videos for psychology students. Recently we've been taking a look at how to improve or how to get better in your psychology studies from my experiences as a psychology lecturer and tutor. But today we're doing something different and we're taking a look at a topic for the general public, as we often do on GetPsyched, for kind of general mental health. And this week we're taking a look at borderline personality disorder. Now we're going to be taking a look at what borderline personality disorder is all about, how we kind of come about to understand borderline personality disorder, and also how it's treated. If you've been enjoying GetPsyched, then don't forget to hit the subscribe button, guys. You can also hit that little bell next to the subscribe button and you'll get weekly reminders every time I upload. And if you've been enjoying today's video, or if you're about to enjoy today's video, then make sure to hit that like button. You can comment on the video and I'll be sure to get back to you. And you can also share the video on social media. By all means, do that. So, borderline personality disorder. Let's take a little bit of an overview as to some information that we need to be aware of when we're thinking of borderline personality disorder, or BPD. The statistics tell us that about 1 in 100 people have borderline personality disorder. There are a few issues around BPD though. Often it's very under-recognized, and there's also a lot of debate as to the legitimacy of borderline personality disorder. Now, I really want to make sure that that's clear, that not everybody agrees that this is actually a thing. But we have to think a little bit about, if this is a thing, what are some of the barriers and what are some of the kind of factors that contribute to understanding borderline personality disorder? Well, there's a lot of stigma around BPD, and it leads to a lot of uncertainty around some of the criteria and some of the symptoms and to actually what borderline personality disorder is. Due to this, there's some issues with diagnosis and with treatment. So that's one of the big issues, is that really this is a blurry topic, and a lot of times people may even have their own understanding of what borderline personality disorder is, and there can be some real conflicts in diagnostic criteria and even some of the criteria that need to be met in order to be diagnosed with borderline personality disorder. There's a lot of kind of comorbidity, for example. So, borderline personality disorder can often be blended with anxiety or depression, and therefore it can make it really difficult to know if somebody really does have BPD or not. So, if we are to think about the potential legitimacy of borderline personality disorder, what is it actually like? What is it like to have borderline personality disorder, or what kind of things happen to somebody when they have BPD, and how can we recognize that? Well, one of the first things is that there's difficulty in regulating and controlling emotions. Something that we call emotional dysfunction, or kind of emotional irregularity, can be really commonplace in borderline personality disorder. And this can lead to a number of different things. So for example, somebody could have a really high, elevated mood and then immediately crash into a very low mood. Now, if you know anything about GetPsyched, if you've been keeping up to date with some of our content, you'll know a little bit about bipolar disorder perhaps, and you can start to see that maybe there's a bit of a blurring of the lines between borderline personality disorder and bipolar type 1 or type 2. And so it can be a little bit confusing to know whether or not somebody has bipolar or whether or not somebody has BPD. It's again one of the barriers that we have in actually diagnosing BPD. But that kind of emotional irregularity is a really common feature of borderline personality disorder. It can also be in a day-to-day occurrence. Somebody could have a really strong, powerful connection with somebody, have that instantaneous connection, really enjoy that person's company, and they can become the flavor of the month almost. And then the next month they can't stand that person, So that's a quick example of how emotional fluctuations can happen. That regulating and controlling emotions can be really difficult for people that are suffering from BPD. Psychiatrists often, and psychologists also, talk about an instability of self, or what we call a dysregulated self-image, which is a really common feature of borderline personality disorder. Now, this can be kind of evident in a practical way when somebody, is kind of hot and cold about how they appear or what they think of themselves. That kind of dysregulated self-image can lead to almost a bit of numbness as to how a person really views themselves. So there's some criteria that need to be met around how that person actually sees themselves. And if there's the dysregulated self-image, then sometimes we could argue that there's maybe a case for borderline personality disorder there. Another key feature is to have, when somebody maybe has very intense and unstable relationships over prolonged periods of time, going from a period of loving somebody to hating somebody. And often actually that can be very evident in work as well. Somebody could get a new job and they're overwhelmed by how much they love their job, and then there's a couple of weeks in or a couple of months in and it nosedives. Now, for all of us, that kind of thing can happen. Of course, we can be very connected to somebody one month and then really not connected to them the next month, or we can love our job one week and hate our job the next week. So again, this is some of the challenge that we have in actually diagnosing borderline personality disorder. But when that is a prolonged thing, when there's a prolonged period of time that these relationships, there's a bit of a pattern that somebody acts like this with relationships, or somebody is like this in multiple different jobs, that's when we start to think a little bit about borderline personality disorder. So it wouldn't be fair to just say, oh, because somebody is hot and cold with one relationship, or on and off with one relationship, or they hate or love their job every now and again, we wouldn't necessarily say that person has borderline personality disorder. However, if they do it with multiple relationships, or they do it with multiple occupations, then we could start to speculate a case for BPD. Often, and from my experience of working with clients with borderline personality disorder, there can actually be some really sad diagnostic criteria that are met when somebody experiences borderline personality disorder. And one of those key features is a sense of emptiness. And I think that speaks to the emotional dysregularity that people can experience who have BPD. It can be really hard to grasp how they feel in the moment. It can be really hard for some individuals actually to trust their emotions, and that can lead to a sense of numbness, can lead to a sense of emptiness as well. So that's a really key feature, I think, often with somebody who's suffering from BPD, is when they feel that sense of emptiness or that sense of numbness, then that's maybe one of the criteria we would use to associate towards a diagnosis of borderline personality disorder, potentially. There are a couple of other things as well to consider when we're thinking about the potential criteria or the potential category of borderline personality disorder when it comes to an individual. And one of those things is when somebody partakes in impulsive or risky behaviors. Now, again, this is something that can be quite blurred with bipolar disorder. Bipolar type 1 in particular, somebody may have a manic state where they clear out their credit card and they go on holiday, or they buy a Ferrari or something like that, buy a new house, and they just go into crazy debt, and they just, that's a bit of an extreme example, but that would be an example of a manic state in bipolar, particularly bipolar type 1. But that impulsiveness, that risky behavior is also a diagnostic criteria within borderline personality disorder. Somebody who's not particularly good at reasoning, so poor reasoning is another criteria that we maybe would use to consider a diagnosis of borderline personality disorder. Somebody who's not able to evaluate risk appropriately. Somebody maybe who goes into social situations and doesn't really apply to normal social rules or standards. That again would be part of a criteria of borderline personality disorder. So impulsivity, risky behaviors, poor reasoning are some of the other criteria. One thing I would mention is I've listed a number of different criteria here. If somebody experiences just one or two of these, we wouldn't go down the road of diagnosing borderline personality disorder. Somebody would have to have a multitude of these criteria in order to simply be considered for a diagnosis of borderline personality disorder. And how I often work is some clients find diagnosis really beneficial, and I work in a kind of qualitative way. So we would collaborate toward a diagnosis that maybe feels right. And sometimes with clients I've worked with, and we've talked a little bit about maybe there's some borderline personality disorder going on here. If that's fitted for that client, if that's been helpful for their treatment, and if they've met a multitude of these criteria, and only if those things would happen, would we start to consider treatment in the path of a diagnosis of borderline personality disorder, potentially. One of the other things I wanted to cover in this video is what is the reasoning for borderline personality disorder? As in, where does this actually come from? How do we understand this? And one of the key things to say in a video like this is that not everybody agrees with borderline personality disorder. Not everybody is in line with whether or not this thing actually exists. And so therefore there's not a lot of understanding, there's not a lot of clarity around borderline personality disorder. If you're in that group that agrees that this is something that does exist, even if you are, it's still not fully understood as to how this comes about. But what is clear is that there's an element of genetics and early life experiences that potentially contribute to a potential diagnosis of BPD. So for example, we know that genetics can play a role when it comes to mental health difficulties or mental health or mental illnesses. And actually, I think we did a video on this about the genetics of mental health, or the brain and mental health, I think is what we did. And I think we also have some blog posts on this as well. Genetics play a role in mental health disorders. So, like many mental illnesses, there's chemical imbalances in the brain that go on. For example, in depression, there's a lack of serotonin at times, and the reuptake inhibitors, the antidepressants that are used, are there to allow more serotonin to be in the brain. So there's a chemical imbalance that often can go on in the brain when it comes to depression. We know, for example, with things like schizophrenia, that if an individual has schizophrenia, there's a very high percentage chance, over 50% chance, that one of their offspring will have schizophrenia. We also know that if you have a sibling who has schizophrenia, there's over a 70% chance that you'll have it. And the chances are even higher of having schizophrenia if you have a twin with schizophrenia. So we need to think, obviously there's an element of genetics here, and the same goes for borderline personality disorder. However, we cannot overlook the fact that early life experiences of trauma, abuse, neglect, isolation, alienation, depression, or just experiencing depression in the family, for example, may lead to experiences of borderline personality disorder. So there really is a balance between genetics and early life experiences. Whenever a psychiatrist or a psychologist looks at borderline personality disorder, they look at a person's behavioral patterns and determine if the personality traits or behaviors of the person are inflexible, pervasive, long-standing, or lead to distress or impairment. Now, these are the kind of things, these are the criteria that the psychiatrists or psychologists almost use to measure the criteria for borderline personality disorder. So they want to think a little bit on those lines as well. So how does somebody actually recover from borderline personality disorder, or how is this kind of thing treated? Now, I'm only going to talk about one thing here for treatment for borderline personality disorder, and that is therapy. Now, I often think on GetPsyched, because I'm a psychologist, because I'm a counselling psychologist, I think people think I can be really biased towards therapy. And there's maybe a part of truth to that. Maybe that's a little bit true. Maybe it'd be a little bit different if GetPsyched was created by a GP or a psychiatrist or even a clinical psychologist, perhaps. But therapy in itself is deemed to be the most effective form of treatment for somebody with borderline personality disorder. But specifically, there's a form of therapy that can be particularly helpful, and that's dialectical behavioral therapy, or DBT. I know I'm throwing a lot of abbreviations at you today, but DBT is deemed to be very, very helpful. I'm going to give a very short synopsis on what DBT is. Fundamentally, DBT is concerned for the opposing forces that contribute to borderline personality disorder, and that is acceptance and change. What can often happen is someone with borderline personality disorder can become very offended. They can become quite affronted with people when they don't agree, or when they're pulled up on something, or when they're accused of something. Now, often in therapy, these kind of things can present themselves. It's inevitable. So there has to be a process of the therapist that allows them to accept that person, to recognize that this is borderline personality disorder, and that it's not that individual's fault, that this is a diagnostic condition that is aiding issues with that person's mental well-being. So there has to be a level of acceptance that's there from the therapist. But there also has to be a part of that therapist that pushes for change and looks at a process of change and how that person might be able to change their cognitive patterns or their behavioral patterns in order to experience more functionality in their day-to-day lives, or more functionality in their relationships, and ultimately more improvements in their mental well-being. So the two cornerstones of DPD are acceptance and change, and that can be really, really powerful when we're working with somebody with borderline personality disorder. I think you can yourself, think about the challenges a person with BPD might have with a therapist. Often what happens is there's a hugely high dropout rate in therapy from people with borderline personality disorder. And I think when you think about the criteria that we've discussed today, when you think about the structure of borderline personality disorder, you could understand that therapy might not be that conducive an environment to somebody with BPD. And so often there can be a very high dropout rate. And often also what happens is there can be a high dropout rate and the person then returns, and then they drop out again, and then they return, and they drop out and they return. So that can be a kind of an understanding. It's understood by therapists that can be a process for people with borderline personality disorder. So along with maybe thinking about dialectical behavioral therapeutic principles, that therapist also has to have a very high degree of patience and understanding when it comes to borderline personality disorder. But even if it takes multiple cycles for that client to come out of therapy, back into therapy, out of therapy, back into therapy, therapy itself can be highly, highly effective for somebody when it comes to managing their borderline personality disorder and also experiencing improvements in their mental well-being. Okay guys, thank you so much for watching this week's episode of GetPsyched. This week we've been taking a look at borderline personality disorder. We've been looking at what makes up borderline personality disorder, the diagnostic criteria, and the things that psychiatrists and psychologists have to consider when they're thinking about borderline personality disorder. There's also something in this about understanding that not everybody agrees with BPD. And I do want to make that really, really clear. People will watch this video and say this isn't even a thing. I don't know why you're making a video on it. That's totally fine. You can let me know in the comments about your opinion. I'd love to hear it. If you've been enjoying today's video, guys, then make sure to leave a comment. You can like the video, you can share it as well. And if you've been enjoying GetPsyched as a whole, don't forget to subscribe to our channel and hit that little bell next to the subscribe button, and you'll get weekly reminders every time I upload. Thanks again for watching, guys, and hopefully catch you next week.